You are thinking about starting testosterone therapy, but here is a problem. If you just start treatment, you may never know if it actually worked. So before you start, you need to answer one key question. How will you know if it's working? Here is the answer. You need to treat it like a structured trial. My name is Dr. Fuzayloff. I'm a hormone replacement specialist in Midtown Manhattan. Let me show you how I approach a testosterone therapy trial. First, not everyone should start a trial. So before I do this, I confirm three things. Your symptoms are consistent, not fluctuating day to day. Your testosterone is low or low normal on at least 2 morning tests. And there is no clear reversible cause, like poor sleep, recent illness, or stress. If these are not addressed, the trial will not be reliable. So let's define the goal. The goal is not just to raise a number. It has 3 parts. Improve your symptoms, bring your testosterone into the normal, healthy range for your body, and avoid side effects. Because at the end, we need a clear answer. If symptoms do not improve, the treatment is not successful, even if the level goes up. Now, the most important step. This is how you actually determine if it's working. You need to track your symptoms properly. Choose 3 to 6 main symptoms that matters for you. For example, libido, morning erection, energy, focus, motivation. Track them every day for about 2 weeks before starting treatment. Use a simple scale from 0 to 5. This gives you a baseline. Because without a baseline, you will not know what actually changed. At the same time, keep your lifestyle stable. Your sleep, your diet, your weight, your exercise. Because if this change during the trial, you will not know what caused the improvement. And don't focus on day-to-day changes. Look at the overall trend. Now we start therapy. Injection or gel are most common. They allow better control and more stable levels. Now let's talk about timing. This is where many people get confused. Testosterone level can change quickly, but symptoms take longer. Most people do not feel much in the first couple of weeks. That is normal. And not feeling much early on does not mean it's not working. Energy, mood, and libido usually takes about 6 to 8 weeks. Body composition changes may take closer to 12 weeks. So this is why the trial has to be long enough. If you stop too early, you will not get a clear answer. And during this time, we also monitor labs, not just testosterone. I check things like your blood thickness, your estrogen level, and a prostate marker when appropriate. Because this trial is not just about improvement. It's about making sure your body handles the treatment safely. Now let's interpret the results. After about 8 to 12 weeks, we'll look at 2 things. Your testosterone level, usually in a normal range, often around 350 to 750, and your symptoms. This is where we decide you are responding if your level improves and your symptoms improve in a meaningful way. By meaningful, I usually mean about 30 to 50% improvement, not just small change. You're not responding if your testosterone level increases, but your symptoms do not improve. And this is very important. In that situation, I stop treatment. because continuing without symptom improvement only exposes you to risk without benefit. Now, there is also a third situation, partial or unclear response. Some symptoms improve, others do not. In that case, I may adjust the dose, work on sleep, diet, or exercise, or extend the trial before making a final decision. One more important detail, I do not look only at total testosterone. I also look at free testosterone and SHBG. Because sometimes total level look normal, but the active hormone is still low. So the way to think about testosterone trial is simple. We're not just trying to raise a number, we're trying to answer one question. Does improving testosterone actually improve how you feel and function? If yes, we continue. If no, we stop and look for other causes. And that gives you a clear answer. If your level are borderline and your symptoms are unclear, this approach gives you a clear way to decide what to do next. If this was helpful, subscribe to the channel. I explain testosterone step by step based on real clinical practice.